Hi everyone, my name is Vianney Lopez Hernandez, and today I'll be presenting my evidence-based practice project proposal. My topic is on automated insulin delivery for adults with type 2 diabetes. This project focuses on whether these systems can improve blood sugar control and outcomes compared to standard insulin therapy. My problem statement: type 2 diabetes is one of the most common chronic illnesses worldwide, and its rates continue to increase every year. Many patients eventually require insulin, but even then, a large number fail to reach safe glucose targets. For example, patients may forget doses, struggle with calculating how much insulin they need, or fear experiencing low blood sugar. All of this makes it harder to manage the disease. Poor blood sugar control doesn't just affect the numbers, it leads to serious complications like heart disease, kidney failure, and vision loss, and it also causes frequent hospital admissions. These complications can lower a patient's quality of life and increase healthcare costs. As nurses, we're often the ones monitoring glucose levels, giving education, and helping patients adjust their insulin routines. This puts us in a unique position to see where the traditional methods may fall short. The research question guiding my project is: does automated insulin delivery improve blood sugar control and outcomes compared to standard insulin therapy in adults with type 2 diabetes? If the answer is yes, then this could change how we manage type 2 diabetes in practice. Background and evidence. Research shows how strong support for automated insulin delivery, or AID. Kudva and colleagues in 2025 performed a randomized controlled trial and found that patients using AID had lower hemoglobin A1C values and spent more time within their target glucose rate. Hemoglobin A1C is an average of blood glucose levels over 3 months, and lower values are strongly linked to fewer long-term complications. Pascal and colleagues in 2025 studied AID in large, diverse group of insulin and in real-world settings. Their results showed similar improvements in blood glucose control and, importantly, very few safety issues. This is important because sometimes what works in research trials doesn't always work in the real world, but this study confirmed AID works in both. A review by Carroll in 2022 pulled together best results from several smaller trials. Their conclusion was that AID consistently improves glucose management, though they also noted that most studies were short-term, which means we need longer studies to fully understand its benefits. Finally, in 2025, the FDA approved the first AID device specifically for type 2 diabetes. This shows that there is now enough evidence of safety and effectiveness to recommend it for clinical use. Despite all the progress, most patients are still managed with traditional insulin therapy, which can be burdensome and less effective. This gap between what research shows and what is happening in practice is exactly why the project is necessary. Project objectives. The purpose of this project is to evaluate how effective AID is compared to standard insulin therapy. My first objective is to measure whether AID reduces hemoglobin A1C levels over 6 months. Lower hemoglobin A1C means fewer complications, fewer hospital visits, and better quality of life for patients. The second objective is to assess patient satisfaction and confidence in using AID. Patients feel confident and supported. They are most likely to stay engaged in the treatment and continue using the evidence long term. The third objective is to look at the barriers and supports for using AID, including cost, staff training, and patient readiness. These factors often make the difference between a successful project and one that struggles. The fourth objective is to track hypoglycemia episodes to compare safety between AID and standard therapy. Hypoglycemia can be scary and dangerous, so ensuring AID is safe is just as important as proving it works. These objectives are specific, measurable, and clearly aligned with improving diabetes care. Methodology and intervention. This project will use a quasi-experimental design with two groups, one using AID and one with continuing the standard insulin therapy. A quasi-experimental design is appropriate here because it allows comparison in real-world setting without having to randomize patients, which may not always be realistic or ethical. The intervention is to provide patients with AID devices, including continuous glucose monitors and insulin pumps, and to give both patients and staff training on how to use them. Nurses will be central to this process because it will teach patients, answer questions, and help troubleshoot issues that may come up. The implementation plan involves several steps. First, staff will complete education sessions so they are confident in teaching and supporting patients. Second, patients will receive training on how to use their devices at the beginning of the project. Third, follow-up visits will be scheduled at baseline 3 months and 6 months to check on the progress. Finally, ongoing support will be offered, such as helpline or troubleshooting sessions to make sure that patients don't feel alone in managing their devices. And barriers are expected, such as the cost of the devices, insurance coverage, and patients who may be uncomfortable with technology. These can be addressed by helping patients navigate insurance, offer simple step-by-step teaching, and continuing support over time. In this way, the project design will not only test aid, but also look at how it can realistically be adopted in practice. Evaluation plan. To evaluate the effectiveness of the project, multiple measures will be collected. Hemoglobin A1C levels will be measured at baseline and again at 6 months to see if there's improvement. Continuous glucose monitoring will track the percentage of time patients spend in the test range, 70 to 180, which is another important measure of control. We will also record how many episodes of hypoglycemia and hyperglycemia occurs in both groups because safety is always a top concern. And patient satisfaction will be measured with surveys, which allows us to see the changes in confidence and satisfaction over time. Provider feedback will also be collected to better understand how nurses and other staff feel about implementing aid. Ethical considerations include obtaining informed consent, making sure patient data is kept private and secure, and ensuring the participation is voluntary. This evaluation plan ensures that the project is safe, ethical, and produces data that can guide future practice. Expected outcomes and implications. We expect that patients using aid will have better hemoglobin A1C results, spend more time in the target glucose range, and report higher satisfaction compared to those on standard therapy. We also expect that the number of hypoglycemia episodes will remain low, showing the system is safe to use. On a larger scale, if AIDS becomes more widely used, it could reduce the number of emergency visits and hospitalizations due to uncontrolled blood sugar. This could save money for healthcare systems while also providing quality of care. Conclusion. In conclusion, automated insulin delivery is an evidence-based technology that has been proven safe and effective in research, but is still under use in type 2 diabetes care. This project will test its use in real practice and help identify barriers, supports, and outcomes. The project reflects the core of evidence-based practice, using the best available research, applying it in real settings, and evaluating its impact. By doing so, we can continue to advance nursing practice and improve the lives of our patients. And of course, my last slide is my reference slide, and that's it. Thank you for listening.